does a short leg cause scoliosis? In this video, you're going to learn exactly what signs to look for and what steps you can take if you think a short leg might be affecting your spine and contributing to a curvature such as scoliosis. I'm going to show you how the body reacts to an uneven foundation, how those reactions can build into a spinal curvature, and what you can do early to help prevent it from getting worse. You will see clear visual examples, simple at-home tests you can try right away, and the key indicators that often get missed during routine checkups. By the end of this video, you will know what to look for, what actions to take, and how a small leg length difference can become a much bigger problem if it goes unnoticed.
Hi, I'm Dr. Whitney Wihilidal, a chiropractor in Orillia, Ontario with over 25 years experience and a background in gait analysis, biomechanics, and neurology. My mission is to provide a thorough solution to spinal problems that develop from an unlevel foundation, like anatomical short leg, spinal and pelvic misalignment, poor posture, and foot dysfunction. This channel is for people dealing with chronic pain, like back pain, sciatica, neck pain, poor posture, headaches, and are looking for real lasting relief. You'll get clear step-by-step strategies to address the root cause of these conditions and start feeling better fast. Subscribe now for real solutions for pain relief, better posture, and a clear understanding of what's causing your symptoms so you know exactly what to do next. I upload a new video every week. Before we dive in, I want to give you a clear picture of why this topic on short leg matters. A small structural imbalance in one leg can change the way the spine carries weight, and many people never realize it's happening. These changes often start early in life and can shape how the spine develops during the rapid growth period of childhood. The earlier you understand these patterns, the easier it is to guide the spine in a healthier direction. In the next few minutes, I'm going to show you what these changes look like, why they are often missed, and how to spot them before they lead to bigger problems. This sets the stage for everything we are about to cover. Now we'll use the spine to show what a lateral curve in the spine or side-to-side curve in the spine looks like and how a short leg can affect that. Now, just for clarity's sake, when we look at a spine from the side, there are natural curves in it. Those are totally normal. But what we're talking about is the spine when you look at it from the front or from the back. It should line up straight up and down in an ideal situation, and the pelvis should be nice and square underneath it. So in a situation where you have a leg length difference, what happens is one leg, when it's shorter, will cause the pelvis on that side to tip. When that happens, all of a sudden your foundation, again, not being level, doesn't allow the spine to very easily sit straight up and down. And most often, the first thing that'll develop is a sideways curve. We're going to explain in future videos how the body adapts to that and all the other connections as well. But right now, for argument's sake, we're just going to talk about the leg length difference. So when one leg is short, the pelvis will unlevel, the spine will generally curve to the side of the short leg. So the way we correct for that is we use a full length lift. So what that is, and these are just different examples of them, is it's a full length lift that you can either use inside of footwear or has to be built onto the outside of footwear, depending on the thickness of it. But you can use different amounts to determine what brings the spine back to level. So essentially what we do is we'll have a person stand on a posture unit and we'll take one of these lifts and we'll place it under the short leg. When you do that, you can see how the body adapts to that lift and how it brings it back up. I equate it to walking on the sidewalk and on the road at the same time. So if you're standing with one foot up on the sidewalk and one foot down on the road, you can see how your spine or your pelvis is going to want to tip down to the side that's standing on the road, and then the spine's going to have to bend to try and keep you upright, okay? That's essentially what we're trying to correct for with these lifts. Now, obviously, it won't be that dramatic, but that's what we're talking about. So these lifts will then, again, bring you back into better balance and improve the spinal alignment. To understand how a short leg can influence the spine, we need to be clear on what an anatomical short leg actually is. This is a true structural difference in the length of the bones, not just a muscle imbalance or a posture habit. One leg is physically shorter, even if the difference is only a few millimeters, as demonstrated by my Jenga blocks. That small structural change can shift weight to one side, tilt the pelvis, and place more stress on one half of the body. Many people never even know they have a short leg because it rarely causes pain at first, and most routine exams do not measure for it in a precise way. Without the right evaluation, the early signs can be easy to miss, especially in children who are still growing.
When the body is standing on an uneven foundation, everything above the pelvis begins to shift in order to stay balanced. The taller leg lifts one side of the pelvis while the shorter leg allows the opposite side to drop. This creates a tilt that changes how muscles fire and how weight is carried, and how each segment of the spine begins to compensate. These compensations feel completely normal because the body wants your head level and your vision stable. The problem is that these small changes, repeated every single day and over time, create patterns that quietly influence the shape and movement of the spine. This foundation shift sets the stage for what happens next, which is the reflex that drives many of the early changes in developing a curve.
Your body has a built-in response that keeps your head level with the world around you. This is known as the righting reflex. You feel it every time you stand on uneven ground. For example, if you step on a small stone with one foot, your pelvis tilts and your spine and posture automatically compensate to bring your head back to center without even having to think about it. Your body does it automatically. The same process happens when one leg is structurally shorter. The pelvis sits uneven and the spine and posture compensate by bending or rotating just enough to balance your vision and keep your head level. These compensations are subtle at first, but when they happen all day, every day, especially in children during growth, they begin to shape how the spine develops. This automatic response helps explain why early curve patterns often begin long before anyone realizes something has even changed. The important part about this righting reflex is that it must be accounted for when it comes time to determine the appropriate lift to correct a short leg. Early scoliosis signs are easy to overlook because the body hides its compensation so well. A slight pelvic tilt can look like normal posture, and the small shifts in the spine can seem like everyday variation. Most routine checkups focus on the visible curve, not the underlying cause, which means that anatomical leg length differences are often missed altogether. This becomes even more important when we talk about idiopathic scoliosis. Idiopathic means there is no single clear cause, but it does not rule out contributing factors. In some children, a true anatomical short leg adds extra stress to the pelvis and spine, and that stress can speed up early curve development and growth. Because children grow quickly and because the spine adapts so easily during these years, changes can appear faster than parents expect. Understanding this gap in early detection is one of the most important steps in preventing a mild pattern from becoming a significant and problematic curve. Once the spine begins to compensate for an uneven foundation, the body repeats the same pattern every day. In the early stages, these changes are flexible and easy to miss. As a child grows, the muscles on one side begin to work harder. The opposite side becomes weaker. The joints slowly settle into a new alignment. Each growth spurt adds another layer to that pattern, which is why some curves seem to appear to progress really quickly. If the imbalance is never addressed, these repeated compensations can create a more stressed and uneven foundation of the spine. This does not mean the short leg is the sole cause of the severe scoliosis, but it can make the curve more complex because the pelvis is tilted and the spine has to compensate above it. This combination can influence how the curve develops and how it responds to treatment, and potentially how it can progress and worsen. I will talk about how we support the short leg in a moment, but first it's important to understand how these adaptations affect adults and children in very different ways.
When an anatomical short leg is identified in an adult, the goal is to improve balance and reduce the stress placed on the spine. One of the most effective ways to do this is by supporting the short leg with a full lift. If the difference is small, say 5 millimeters or less, the lift can often be placed inside the footwear. If the difference is more significant, it may need to be added to the outside of the footwear. The point is, once we determine how much correction it is that's needed, it isn't difficult for an appropriate height lift to be implemented. Even a small amount of support can level the sacrum, balance the pelvis, and reduce the compensations that have been stressing the spine for years. Many adults notice less strain, better posture, and in some cases an improvement in their scoliosis curve and the sometimes painful and irritating symptoms that are occurring because of it. Now, in the case of children, they respond even more dramatically. Since their bodies are still growing, their tissues adapt quickly. When a child has an anatomical short leg, along with the early signs of a curve, the right support under the short leg can help guide the spine in a more balanced pattern during growth. This early intervention is powerful. With proper support, we can reduce progression and sometimes change the entire path of curve development. As promised in my intro, let me show you a quick screening test that you can do at home to check for early signs of a curve or a possible short leg. You can learn a lot from a few simple checks at home. These tests aren't meant to diagnose anything, but they can reveal early signs that deserve attention. Start with a quick look at your child's posture. Have them stand comfortably with their feet shoulder width apart. Look from behind to see if one shoulder sits higher than the other. Check the waist creases on both sides. A deeper crease on one side can show that the spine is compensating. Then, while standing behind your child, ask them to bend forward slowly. What you're looking for is any unevenness in the ribs or in the lower back. Even small differences can be an early sign of a developing curve. Next, take a moment to check for signs of a possible short leg. To do this, have your child stand barefoot on a flat surface. Look at the level of the pelvis from behind. If one side appears lower, that may indicate a structural difference. You can also have them sit on a firm chair with their feet flat on the ground. If one knee is higher in the seated position, it could suggest that the bones in the legs are different lengths. One final test is to have your child stand like a flamingo on one leg, on a solid surface. Without holding on to anything, once they are balanced, have them close their eyes. If they cannot hold their balance for 3 to 5 seconds without tumbling to the side, this is an indication that the righting reflex is being challenged in a way that prevents it from responding appropriately. Although this does not confirm a short leg, it's an indicator of a potential spinal problem that is worth being investigated for the cause. These simple checks help you understand how your child is standing, moving, and growing, and whether further evaluation may be helpful. These at-home tests give you a clear picture of what is happening with your child's posture, and they often reveal patterns that routine exams miss. If you notice something that concerns you, knowing what to do next is just as important as what to find. So let me walk you through the steps that come after these checks. If you notice signs of a spinal curve or a possible short leg during the at-home checks, the first step is to document what you see. Take clear photos or short videos from the front, the back, and the side. Include the forward bend test as well. This gives you a record that you can compare over time and helps you to see whether anything is changing. The next step is to schedule an evaluation with a provider who understands both scoliosis and anatomical leg length differences. Not everyone checks for these patterns, so it's important to see someone who knows how to measure true structural differences and how to read the way the spine is compensating. Early assessment does not mean there's a serious problem. It simply gives you clarity and helps you to make informed decisions. If a structural leg length is confirmed, taking action early can help reduce stress on the spine, improve posture, and slow or limit progression, especially during growth. The goal is to support the spine before the body builds strong compensations and before the curve becomes harder to influence. Everything you have seen in this video comes down to one simple idea. A small structural imbalance can shape the way the spine grows, shifts, and adapts. When that imbalance is not noticed early, the spine responds in ways that can lead to measurable curves, especially during the rapid growth of childhood. The good news is that you now understand the signs to look for, the simple tests you can use at home, and the steps you can take if something appears uneven. Early awareness gives you a real advantage. It allows you to support the spine before the body builds strongly ingrained patterns and before the curve becomes more rigid. Whether you're checking your own posture or looking at your child's alignment, these early observations can guide you towards better decisions and better outcomes. If you found value in this video, like and share it so more people with scoliosis or posture concerns can learn about anatomical short legs and how they can affect your spine. If you have any questions, drop them in the comment section below. Be sure to subscribe to my channel if you want real solutions for pain relief, better posture, and a clear understanding of what is causing your symptoms so you know exactly what to do next. And if you have chronic back issues and want to see how a short leg contributes to that pain, and more specifically how we address it with lifts, go watch this next video.